Hello everyone, welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please put a message in the comment section. Thank you. Hello, 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 hello. Is my voice coming to everyone? Yes or yes, yes. Hello everyone, I'm Dr. Anand. Welcome to Unacademy NEET PG platform. So we're gonna start some amazing segments. Yes, I think it's visible. मैं लेट तो नहीं हो गया? बहुत क्या? बहुत चर्चा करते हैं. लेट हो गया हाँ जिम. या जल्दी हाँ सॉरी यार लेट हो गया वो 2 मिनट लगते हैं कनेक्ट होने में टाइम लगता है. ओके चलो वेलकम टू एवरीवन वेलकम टू पीडियाट्रिक्स बाय डॉक्टर आनंद. First of all, congratulations. Thank you so much for the amazing, mind-blowing response. 15 days NEET PG Unacademy Plus subscription only at rupees 299. I mean, what do you get at 299? If you go to Miniso, everything is expensive. Zara, all brands expensive. 299. Seriously, 299? Yes, it is 299 for few days. Valid only between May 9th and May 16th. A 15 days NEET PG Unacademy Plus subscription at just 299. Today only 15 students got it back to back. So I mean, if you want to clear, I mean, just get it. Otherwise, it's okay, no problem. In the Unacademy, first of all, we have something known as Plus subscription, where amazing access to our live and recorded classes. Educators are good. Content quality is amazing in the Plus subscription. Also, for the beautiful, light-hearted students, we have something known as Unacademy Lite. For the light students, basically, which has the previous year question papers and also the grand test pertaining to NEET PG FMG series. It is important for all of us. Good evening, everyone. मेरा चेहरा ठीक लग रहा है? Is my face looking good? Is it glowing well? Yes, exactly. Nikhil, so sweet. Nikhil is saying that in Miniso you get cute hand sanitizers. You and me have quite a same taste, I feel sometimes. So yes, very importantly, we have this NEET PG 2022 All India mock test happening on May 14th at 9 a.m. It's gonna be beautiful. And also for the same this one, and if you want to get this 299 wala pack, the pin code over here is Dr. Anand to unlock this session. FMG batch has been going amazing, which is basically the MCQ batch starting from May 11. This is my $1 million photo, and amazingly beautiful other educators are also there. Also, UPSC is quite a deal nowadays. Everyone is really trying to get a good rank in UPSC. People are want to become IAS officer. How many of you want to become an IAS officer? Remember, let me know, because many of my friends, they are applying for IAS. And yes, I went to gym. Yes, this is my $1 million biceps. So this is a UPSC CMS revision pack, also going beautiful. And as I recommend everyone, give as many tests as possible, bro. ENT, PSM, medicine, surgery, gynae, every day 10 p.m. If you are free, put an alarm, give a test. It's so simple. I always say to at least do last 3-year question papers. They are really very important. They are free of cost, available on the Unacademy app. Go to self-study, practice and subject and avail all the important MCQs. You will automatically get a notification for automatic daily practice papers. MCQ, MCQ, MCQ. That is the demand of the choice. That's it. UPSC pack is just for 1 and 2 month durations, a quick pack with a very simple price and with a pre-launch price. Also, MBBS students are working really hard to get some amazing rank in the next exam, and next is gonna be crazy for everyone. So enroll. Obviously, we have 3, 6 and 12 months duration and the price and the pre-launch price. Hello, Dr. Nikhil. Dr. Nikhil says, hello everyone, welcome to Pediatrics by Dr. Anand. Dr. Anand, you say Dr. Anand, right? You say Dr. Anand. You don't say Dr. Anand. You say Dr. Anand. I know you. Yes. So that's it. So plus subscription, iconic subscription and light subscription with the beautiful duration and prices. And the pin code is, the coupon code is Dr. Anand. Let's start this $1 million class. In this segment, it's a very quick 30 minutes, beautiful class where I'm going to ask you about important images, important questions, something crazy I'm going to ask you. Okay. And if you don't answer, then you see what's going to happen to you. Before starting any amazing segment, we always have a motivating quote, and today's motivating beautiful quote is the old one, but it's a good one. The quote says, when I hear somebody saying life is hard, when I hear somebody saying life is hard, I am always tempted to ask, compared to what? Life is hard. I agree, life is really hard. Life is hard compared to what? With whom are you comparing? Life is hard with someone who, with the person you are comparing who is having a chartered plane, and from him you are comparing life is so hard. I don't have a chartered plane, I don't have a helicopter. Or someone having a cycle, you're comparing with that fellow, life is so hard, I don't have a cycle. So stop comparing and start accepting the way your life is. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है, उसको वेस्ट मत करो. Live the moment, enjoy the moment, be crazily happy with the moment you are living. That is the biggest gift of your life. Just enjoy that, okay? Don't waste your days and nights. Feel the moment, feel your aura, feel your soul. When you go to gym, just be a beautiful magnetic aura you have, the way I have in gym. And anywhere you go to meet a friend or go to a party, your eyes should sparkle, you should sparkle. And how should I sparkle? Just feel that you're amazing, and automatically amazing aura will start generating. If you feel you are sad, then naturally sad aura will start generating. If you feel hopeless, then hopeless vibes will start generating. And if you feel you are excitedly crazy, then crazy aura will start generating. What do you think? Am I right? Or okay? Let me know. So today's topic of choice is a quick MCQs, quick questions, images, videos, whatever I felt like I have put it. So let's start. Dr. Nikhil, could you please tell me, Thompson, where do you see Thompson's liver and where do you see Thompson's score? Very quick answer. Anyone, where do you see Thompson's liver and where do you see Thompson's score? Any idea? Dr. Osama Sheikh, Avinanda, we have so many amazing nowadays. My classes कुछ ज़्यादा ही लोग आ रहे हैं भैया. Yes, Nikhil is, आज लगता है आज biceps था, actually आज chest था, but कोई बात नहीं. बाइसेप्स हमें छोटे से ही है, तेरे जितने तो है नहीं, तेरे तो बहुत अच्छे हैं. हाँ जी, यस. सो थॉमसन स्कोरिंग, ऑफ कोर्स यू सी इन अ केस ऑफ HIE. ओके, आई एम गोना आस्क यू लॉट ऑफ million questions. Be ready with all the amazing answers. Thompson's score is seen in HIE. And Thompson liver, where do you see Thompson liver? Thompson liver you see in scarlet fever. Thompson liver you see in scarlet fever, whereas Thompson score you see in a case of HIE. See, these all are questions I have put because these are like many students are having confusion in this one. So let's have a very quick beautiful revision. Thompson score, HIE, Thompson liver, scarlet fever. Next important question. Yes, all 6 Christmases we have already done this question, but you always keep forgetting. हाँ जी, आगे आ जाओ. निखिल आंसर दे. हो गया, मजाक बहुत हो गया, तू आगे आ जा. Christmas disease. Can we please tell me where do you see Christmas disease? I have no idea. Happiness, Suman, Monimala, apna Philadelphia. Nikhil, what do you think? Exactly, very good. So Christmas, have you heard of hemophilia? Yes or no? So Christmas disease, obviously you'll see in hemophilia. Exactly. Okay, where do you see what do you call Christmas tree rash? We recently did a Unacademy Derma plus Pediatrics class with Dr. Cheshta. In that, she very beautifully explained about the Christmas tree rash. Could you please tell me where do you see Christmas tree rash? Exactly, Christmas tree disease, of course, hemophilia. Christmas tree rash, yes or no? Have you heard of, very importantly, pityriasis rosea? Very importantly, remember, we are reading this for the first and last time on this planet. Make every single second count. Okay, Christmas tree disease, hemophilia B. Christmas tree rash, अपना pityriasis rosea. ऐसा होता है ना, she told, Dr. Chesha told, Christmas की तरह है, like a Christmas tree, you know, like a Christmas tree, the rash is there, very beautiful. Okay, next important, where do you see Christmas tree adapter? Anyone? We have done this multiple times. Where do you see Christmas tree adapter? मच्छर घूम रहे हैं. हाँ जी. Exactly, Christmas tree adapter, basically it is seen in the oxygen tank. In the oxygen tank, O for oxygen, O for Osama. So in the oxygen tank, basically you have the Christmas tree adapter. And where do you see Christmas tree bladder? Bladder, beautiful bladder. Hanji, Christmas tree bladder, basically it is seen in neurogenic bladder. Neurogenic bladder. Could you please tell me, neurogenic bladder is one of the causes for which disease? Do we have some disease in pediatrics where the one of the causes of dash disease is neurogenic bladder? Dr. Osama, Nikhil, fly on the sky, Panchal, Riddhima, Hanji, anyone? So most importantly, yes, have you heard of nocturnal enuresis? Yes or no? Many a times we have done this class, which is the age cutoff for nocturnal enuresis. बच्चा रात को सुसु करता है. A baby passes urine in the bed. What is the age cutoff? The age cutoff is more than 5 years. And what are the causes? You can say anyone. मैं नहीं बता रहा. हाँ जी, which is the most commonest cause of nocturnal enuresis? Doctor, my 5-year-old daughter, she's passing urine in the bed. Which is the commonest causes? हाँ जी, ये हमने रिवाइज नहीं कर रखा. हाँ जी, मंजू, Saloni, Riddhima, Yashika, Osama, and Nikhil. Hanji, have you heard of UTI? Yes or no? Urinary tract infection. Can a patient of UTI can come to us like mimicking nocturnal enuresis? Yes. Bar bar susu karna, doing susu a lot of times and doing in the night also could be one of the important feature for urinary tract infection. Have you heard of hesitancy, urgency, and frequency? Yes, beautiful, exactly. Hanji, so Osama is right. The other causes definitely, can I write anxiety? Can I write stress? Can I write frustration? Can I write depression? Can I write low self-esteem? Yes or no? Do you agree with me, guys? Yes or no? Hanji, very good, very beautiful. Put your best vibes in the class. Okay, so anxiety, stress, depression, frustration, neurogenic bladder, all these are beautiful causes. And of course, neurogenic bladder is not a very common cause, but one of the causes of apna nocturnal enuresis. So neurogenic bladder, you'll see a Christmas tree bladder, and neurogenic bladder is one of the causes for nocturnal enuresis. हाँ जी, कहाँ पहुंचे हम? So Christmas disease, hemophilia B. Christmas tree rash, apna pityriasis, rosea. You're reading this topic for the first and last time. Tell yourself, okay, you're reading this topic for the first and last time. So 6 Christmases by hearted, you should be inside your brain, okay. Where do you see Christmas tree adapter? Obviously oxygen tank, right? And Christmas tree bladder ho chuka hai, that is neurogenic bladder. What about Christmas tree cataract? Anyone? Hanji, exactly. Happiness is like, should we always exclude secondary causes in nocturnal enuresis? No, any patient comes to us with baby passing urine in the bed, commonest are the nothing but stress, anxiety, frustration, and all those depression. Second, definitely every baby who is passing urine in the bed should always be ruled out for UTI. So urine routine and urine culture is must, okay. Still the baby urine RM is normal, the baby is not having anxiety or stress, then you get an ultrasound whole abdomen done basically, and then you will rule out the neurogenic bladder. As my HOD says, common things are common and rare things are rare. So commonest is the stress, anxiety, and the rare one is neurogenic bladder or kirkardium rhythm issues and all that. Chalo, next one. So yes, beautiful. Let's finish this beautifully. Where do you see Christmas tree sign? Christmas tree sign is seen in paraspinal CSF leak. Paraspinal CSF leak in radionuclide cysternography. 11 days left, okay, just 11 days left for the exam. Give your best shot. Give your best shot, okay. Give your best shot. I want you guys to just rock, okay. Perfect. And of course, just now I was asking Christmas tree cataract, very important, myotonic dystrophy. Myotonic dystrophy, very importantly, please, this is important. Put your best vibes over here. Exactly. Happiness is common things are common and rare things are rare. Yeah, that's true. So myotonic dystrophy, Christmas tree cataract, very good. And Christmas tree appearance of polyp, very important. Peutz-Jeghers syndrome. Very importantly, in a case of Peutz-Jeghers syndrome, this very beautiful Christmas tree appearance of polyp. Very good, Yashika. Very good. Saloni. Happiness, beautiful, amazing. Yes, next question. What can you see in this picture? Could you please mention? Nikhil, Nikhil, answer this. Yes. Can I write craniopagus? Yes or no? Exactly. Social smile? Okay. Social smile? Yes, exactly. Social smile comes by 2 months, undoubtedly, yes. But this is nothing but craniopagus. The head is attached, no? It is known as craniopagus. Perfect. Very quick. 3 questions on this question. Okay, this is A and this is B. Can you please tell me which one is caput succedaneum? Is A is caput succedaneum or B is caput succedaneum? Anyone? Yes, Suman, Mahira, Happiness, Manju, Vaidehi. Yes, beautiful answer. This is nothing but caput succedaneum, and this is nothing but cephal hematoma. Which one is confined to suture line? Is this A or is this B? Which one is confined to suture line? So obviously the confined to suture line I can see in the picture only, nothing but cephal hematoma. B basically is confined to suture line. Nikhil says A, my dear brother. Okay, it's B. Okay, दिख रहा है ना यहाँ पे bro, देखिए it is confined to suture line, whereas caput is a diffuse swelling. Okay, if I say prolonged labor, if I say prolonged labor, then what do you think? Will you think of A or will you think of B? Prolonged labor की वजह से जो swelling होती है, the swelling because of prolonged labor, is it the A or is it the B? Anyone? Exactly. Yes, very good. So because of the prolonged labor, the baby will have a diffuse swelling known as apna caput succedaneum. And of course, as everyone knows about it, instrumental delivery, है ना, traumatic delivery or forceps delivery, the baby will have a hematoma known as cephal hematoma, right? Last question, which one causes jaundice? Which one causes jaundice? Is the A causes jaundice or B causes jaundice? Is caput causes jaundice or cephal hematoma causes jaundice? So beautifully you're answering, everyone answering very nicely. So it's a good quick revision. Okay, hardly any days left, very quick. ऐसे revise करना है. These Unacademy classes nowadays, they are excruciatingly important. My classes, I am taking cardio also, then I'm taking test series also, I'm taking mixed things also, so it's a mixed bag. Exactly. So hematoma, right? Hematoma basically, when there is hematoma means there is hemolysis. When there is hemolysis means hemoglobin breakdown. Hemoglobin breaks into heme. That heme gets converted into biliverdin, and then it gets converted into bilirubin. So more and more hemolysis, more and more jaundice. So cephal hematoma will lead to jaundice, whereas caput will not lead to jaundice. Very good. Very classy picture. If I look at this picture, could you please tell me what should I write in exam? If this becomes today's NEET PG question, अगर ये एग्जाम में आ गया तो हम क्या लिख के आएंगे? पेपर छोड़ कर आएंगे? निखिल बोलेगा मैं तो छोड़ के ही आऊंगा, मेरे को नहीं पता क्या है ये, बेटा जान से मार दूंगा तेरे को तो छोड़ के आया तो. हाँ जी, what do you think exactly? Dr. Suman, yes sweetheart. So you are pack of all rounders, sir. We remember always, we are one family. We all are one family. It's our duty to help each other. I always tell in my classes, any one of you has any extra pointers for whatever picture I show to you, if you have any extra edge of points, do share and finish the whole syllabus. मोती की तरह सब कुछ clear होना चाहिए, right? हाँ जी. Perfect answer. Perfect. Can I please understand this is my caudal part? Can I please understand this looks like a caudal regression syndrome? Caudal regression syndrome, which is also known as sacral agenesis. It is a caudal regression syndrome, which is also known as sacral agenesis. The most specific neurological abnormality in infant of diabetic mother is nothing but caudal regression syndrome. This exactly. Very good. Happiness, very good. Okay, perfect. You all are answering crazily awesome. I'll repeat again. This picture looks like a case of caudal regression syndrome, which was the recent NEET PG question. This picture had come. Do you remember anyone has given any exam recently NEET PG? This was the question they had asked. So this looks like, can you see caudal part बना नहीं है ठीक से? The caudal part has not formed properly. So this is known as caudal regression syndrome, which is also known as sacral agenesis. Very good. Perfect. Okay, if I show you this picture, first of all, which milestone is this and when does it come? Hanji, exactly. This is not phocomelia. Phocomelia is different. In the yesterday's class, I showed you phocomelia. Phocomelia will have all four limbs का problem. Seal-like limbs. पूरा चारों limbs ऐसे बने नहीं होंगे. याशिका डियर, फोकोमिलिया का ना अभी फोटो नहीं है मेरे पास, 11 बजे रात को दिखाऊंगा. बहुत बारी हमने देखा हुआ है, ये वाला फोकोमिलिया नहीं है डियर. सी इन दिस बेबी नो हैंड्स आर ओके, राइट? हैंड्स आर ओके, ओनली लोअर लिम्ब इज द प्रॉब्लम. कॉर्डल what cephal means head, caudal means lower limb. So only caudal regression, or obviously also known as sacral wala part का agenesis, right? फोकोमिलिया लिम्ब डिफेक्ट्स इज डिफरेंट. आई डोंट हैव अ पिक्चर राइट नाउ, इट्स इन माय अदर पीडीएफ. 11 बजे मैं ये दिखा दूंगा, ठीक है डियर. ओके हाँ जी, क्या था ये? अच्छा ये क्या है? हाँ जी, रिकलिंगा. व्हाट इज रिकलिंग? रिकलिंग क्या होता है? हाँ जी. what do you think आशुतोष? what do you think बेनेडिक्ट? anyone? what is this one? this what is this milestone? इसको बोलते क्या है और ये कब आता है? at what age a child can do this is my patients only my house patients only this. हाँ जी, very true. what do you think? what do you think? hey bro. awesome awesome. मेरी क्लास चल रही है, बहुत सुंदर लग रहा है सब कुछ. थोड़ी देर में करता हूँ कॉल. awesome awesome. मेरा दोस्त था, मेरा बेस्ट फ्रेंड उदित, उधर गया हुआ है लंदन, सो जस्ट कॉल्ड. हाँ ठीक है. हाँ जी. हाँ एग्जैक्टली. दिस लुक्स लाइक हॉपिंग. सो कैन वी प्लीज रिमेंबर हॉपिंग कम्स एट 4 years एंड स्किपिंग कम्स एट 5 years. व्हेन कैन अ बेबी राइड अ ट्राईसाइकिल? ट्राई मतलब 3, सो अ बेबी कैन राइड अ ट्राईसाइकिल बाय 3 years. ये हॉपिंग है. हॉपिंग बोलें या फिर लंगड़ी टांग खेलना, हॉपिंग. एंड स्किपिंग बाय 5 years. ठीक है, वेरी गुड. ये निखिल बहुत करता था बचपन में ऐसी हरकतें. निखिल तुम्हारा ही बचपन है ये. ठीक है हाँ जी. नेक्स्ट क्वेश्चन, वेरी ब्यूटिफुल. व्हेन कैन अ चाइल्ड वॉक बैकवर्ड्स? ऑल इन एम्स पीजी 2016 क्वेश्चन. व्हेन कैन अ चाइल्ड वॉक बैकवर्ड्स? yesterday we did crazy 50 100 milestones we revised, right? Can you please tell me when can a child walk backwards? Monimala says your classes are so relaxing. Yes my dear, that's my only intention. Just keep things light, have a coffee, sit, relax, try to answer. And this one, and don't give me that line गलत आंसर आ गया, ऑटो करेक्ट हो गया था एक्चुअली, आई एम सो सॉरी. फिर जब मैं पूछूं, जब आता ना हो तो सर आपकी आवाज नहीं आ रही सर, सर ये वॉइस नॉट ऑडिबल सर. ऐसे ड्रामे नहीं करने मेरे सामने. हाँ जी. अच्छा फिलाडेल्फिया क्या घुमा क्या रहा है ये? निखिल क्या घुमा रहा है ब्रो? सो व्हेन कैन अ चाइल्ड वॉक बैकवर्ड्स? हाँ जी, अ चाइल्ड कैन वॉक बैकवर्ड्स बाय 2 years. निखिल, इन एट व्हाट एज डिड यू स्टार्ट किकिंग अ बॉल? डॉक्टर निखिल, डॉक्टर फिलाडेल्फिया. एग्जैक्टली हाँ एग्जैक्टली. व्हेन डिड यू स्टार्टेड किकिंग अ बॉल? निखिल, व्हेन कैन अ चाइल्ड किक अ बॉल? तुमने कब, व्हेन डिड यू स्टार्ट किकिंग अ बॉल? एनी आइडिया निखिल? डॉक्टर निखिल. ओसामा, व्हाट डू यू थिंक? एग्जैक्टली, अ बेबी कैन किक अ बॉल बाय 2 years. निखिल ने थोड़ा लेट सीखा था, 10 साल पे सीखा था, लेकिन अ बेबी कैन किक अ बॉल बाय 2 years. अ बेबी कैन वॉक बैकवर्ड्स बाय 2 years. Question number 39, obviously already done. Ames June 2017. Tricycle hopping and skipping, of course, 3, 4, and 5. Sounds a beautiful answer. So 3, 4, and 5. मोनी वाला कह रही है बस पैदा होने के बाद ही निखिल ने किक मारना सीखा था. क्यूट क्यूट आंसर, वेरी गुड. Oh, this cutie pie, cutie pie. Say, what is eating? Okay, now first I'll not 1 2 3 4 5 6 7. अच्छा हाँ जी, 1 2 3 4 5 6. ठीक है हाँ जी. कितने क्यूब्स हैं ये? if I look at this picture, ये वाला, this picture, how many cubes are there in this picture? So 1 2 3 4 5 6. When can a baby make a tower of 6 cubes? Very beautifully, we have done that already. अच्छा, एक्सपोर्टिन सेज 4 years. 4 years, तुम्हें जान से मार दूंगा मैं. 4 years. अच्छा अच्छा, तुमने सीखा होगा 4 years पे. 4 years में नहीं करता बच्चा ये. So what is the mnemonic we have? The formula is age into 3. 2 into 3 is nothing but 6. I can see the tower of 6 cubes over here. So a 2-year-old can make a tower of 6 cubes. 3 साल मोनीमला. 3 साल नहीं है डियर. 3 साल कैसे हो गया ये? मैं ये वाला पूछ रहा हूँ, ये क्यूटी पाई जो ये वाला बना रही है, ये वाला सेकंड वाला. सो 1 2 3 4 5 6, टावर ऑफ 6 क्यूब्स a baby can make by 2 years. Very important. Next question, very simple game. Ames 2017 question, which game the child is playing and when does it come? Very beautiful. Can you please answer what is this game guys? What is this? Yes, very good. This game is nothing but, very importantly, can I write over here hide and seek game? Yes or no? Very importantly, can I write peekaboo? Peekaboo, yes or no? Peekaboo or hide and seek? Obviously baby play hide and seek by 10 months. Beautiful answer by Chirag, Monimala, Aryan, Happiness, Aswathi, Saloni, Sambhav, Swati, Avinanda and Yashika. और इतने सारे लोग हैं, बहुत सारे नाम, मैं नहीं बोल रहा, बहुत सारे नाम है. ठीक है ओके. Again, very beautiful, quick, beautiful quote which we have recently studied again. Life is short. Life is short. Spend it with people who make you laugh and feel loved. Don't be in toxic relationship. Please, if you are in some relationship which you are feeling suffocated and you are not able to speak about it, like, this is a very important issue, okay? We all are somewhere at some span of time in a relationship which we are not happy, which we are doing for the sake of others, which we think कि by time everything will be all right. If you are suffocating yourself in a relationship, or if you are suffocating someone else, the best answer is evacuate, evacuate, evacuate. Okay, come out of toxic relationships. And if you are making someone else suffocating, please leave that person. Okay, life is short, right? Spend it with people who make you laugh and feel loved, right? It's a very, जिंदगी बहुत छोटी है, खुश रहो. Now coming to the little tough questions, so देख के चक्कर खा के गिर मत जाना. हाँ जी, exactly. हाँ exactly sir, when will INICT batches there? Okay, अच्छा, ओहो, शुभराज ने कॉपी पेस्ट करके 5, अच्छा 6 लिखो. ये तुम लिखो, एक काम करो, 50-60 बार लिखो. दिख गया है मेरे को, दिख गया है, ये दिख गया है, मुझे दिख गया है, ठीक है. क्यूट, वेरी क्यूट. ओके 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 ओके. हाँ जी, डॉक्टर शुभराज, क्या बोलते हैं उसको, आई हैव टोल्ड आर निशा श्री एंड माई जूनियर्स टू कलेक्ट द क्वेश्चंस फॉर INICT रिकॉल. थोड़ा मुझे 1-2 दिन दीजिए, मैं उसको स्टडी करके I will make a batch, I will start, I'll take a class. Is it okay? Is it okay? Tell me please. Okay, fine. So multiple options are correct. This is little tough one. Exactly. Yeah. Avinanda Biswas says, so you are talking just like my roommate. Okay, that's great. हाँ जी, ठीक है. अच्छा, कहाँ है? चलो, ये बहुत थोड़ा सा खत्म करते हैं इसको, ये थोड़ा दिमाग वाला क्वेश्चन है. Which of the following can cause hypertension in children? Multiple options are correct. It was a PGI question back in the few years back, but we must understand it's a very good question. Hypertension. Now you have to open your mouth. Open your mouth. Ha ha ha. So how do you define hypertension? We will come back to these options, of course. What is hypertension? हाँ जी, आगे आ जाओ, मार खाने के लिए थोड़ा आगे आ जाएं. याशिका, हाउ डू यू डिफाइन हाइपरटेंशन? जवाब तो बड़े खुश होकर दिया, BCA ABC CBC ABC CBC B, है ना? डिफाइन, फर्स्ट डिफाइन हाइपरटेंशन, देन विल टॉक अबाउट इट. ओके, हाँ जी, मोनीवाला, हाउ डू यू डिफाइन हाइपरटेंशन? क्या होता है, कितना BP कट ऑफ क्या होता है इसका? हाँ जी, एग्जैक्टली. ओके ओके. डॉक्टर गिरी, सर यू आर टॉकिंग जस्ट लाइक माई ब्रदर. तू इधर आ जा, तू साथ में जिम करते हैं, तू दिल्ली आ जाए, काम कर. सो हाइपरटेंशन इज डिफाइंड एज BP मोर देन 95th सेंटाइल फॉर द एज एंड हाइट. पहले तो भैया ये पता होना चाहिए. यस, हाँ जी, हाँ. सो प्लीज, दिस इज इंपॉर्टेंट. ओके, डॉक्टर बुशरा, इट्स नॉट जस्ट 140/90 डियर. अकॉर्डिंग टू नेल्सन एंड OP घाय, hypertension is BP more than 95th centile for the respective age and height. Number 1. Number 2, what is pre-hypertension? Have you heard of pre-hypertension, stage 1 hypertension, stage 2 hypertension? क्या ये नाम सुने हैं? नहीं, मैंने तो पहली बार ही सुना है. पहली बार सुना है? नाइस, बहुत, वेरी प्राउड मोमेंट, बहुत ये गर्व की बात है. हमें तो गर्व होना चाहिए कि आपने पहली बार ये नाम सुना है. एग्जाम है कुछ दिनों में, पहली बार नहीं सुनना चाहिए ये. सो प्री हाइपरटेंशन इज बिटवीन 90 to 95th. So it's very beautiful. Okay, have a light mind in your heart and just keep it light. BP more than 95th centile is hypertension. 90 to 95th is pre-hypertension. So what is stage 1 hypertension? 95th to 99th percentile plus 5 millimeter of mercury. I'll repeat again. More than 95th percentile is hypertension. 90 to 95th pre-hypertension. 95 to 99 plus 5 stage 1 hypertension, and stage 2 more than 99 plus 5, right? That is stage 2 hypertension. So easy ना, so easy. Exactly. हाँ जी, एग्जैक्टली. ओह, हैप्पीनेस कह रही है मेडिसिन में सुना था, पीडियाट्रिक्स में हाइपरटेंशन कॉलेज में पढ़ाया ही नहीं किसी ने. वेरी गुड. हम डिपेंड करेंगे ना, हमें रिश्तेदार आएंगे पढ़ाने के लिए, खुद तो पढ़ लेते हैं अगर किसी ने पढ़ाया नहीं तो. ठीक है. सो रिमेंबर, मोर देन 95th is hypertension, 90 to 95th pre-hypertension, 95 to 99 plus 5 stage 1, more than 99 plus 5 stage 2. ठीक है. चलो, कॉजेज ऑफ हाइपरटेंशन, मान जाऊंगा मैं कोई बंदा एक मुझे मीठा मीठा कोई कॉज बता दे बढ़िया वाला। कितना अच्छा ना, मीठा 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 साउंड्स क्यूट। हाँ जी, टेबल करके कीजिए ना सर। ओके मैडम, अभी करता अभी करता, रुक जाओ अभी करता, जो लिखा है वो बताओ पहले। हाँ एग्जैक्टली exactly. क्या ये भी सच है वैसे? ठीक है, हाँ जी, कैन यू प्लीज टेल मी वन, जस्ट वन, ओके आई गिव यू हिंट, इन्फेंट में वेरी इंपॉर्टेंट, एक भैया बता दो, कहीं पढ़ा है हमने, हमने कभी जीवन में डिस्कस किया है द बीपी विल बी हायर इन द बेबी? नहीं नहीं डिस्कस किया। वेरी नाइस, वेरी क्यूट। सो द बेस्ट, द कॉमनेस्ट वन इज रीनल आर्टरी और रीनल वेन थ्रोम्बोसिस। प्लीज टेल योर ब्रेन्स दैट द मोस्ट कॉमनेस्ट कॉज ऑफ हाइपरटेंशन बच्चों में किडनी, if the kidney is affected, if the kidney is affected, then ras will activate, okay, renin angiotensinogen aldosterone system, right? And then that causes sodium water retention and potassium excretion. Have you heard these names? नाम सुने हैं? नहीं, ये तो पहली बार सुना है, पहली बार सुना है, ध्यान से सुन लो फिर। So when the kidney is affected, it will always activate RAS, which is nothing but renin angiotensinogen aldosterone axis basically, which causes sodium and water ka retention. When sodium will retain in my body, my BP will increase. So always in a case of acute kidney injury, renal artery thrombosis, renal vein thrombosis, you will have the hypertension. Next important point, of course, can I say this, is it allowed to say this, that the commonest causes for hypertension could be a congenital renal anomaly, है ना? और कब होगा congenital renal anomaly? आ जाओ आगे, आ जाओ, दो बता दो जल्दी से आंसर, डॉक्टर ओसामा। congenital renal anomaly, if I say congenital renal anomaly, two things should come to my mind. Can you please tell me what is the answer? Okay, can I say single artery and single vein? Normally a baby umbilical cord has two artery and one vein. If you have one artery and one vein, you should rule out renal agenesis, yes or no? If the mother is a case of oligohydramnios, I should rule out renal agenesis in a newborn, yes or no? पढ़ा है ये, कहीं पढ़ा है गलती से? हाँ पढ़ा हुआ है, अच्छा है, लग तो नहीं रहा तुम्हारी शक्ल देख के पढ़ा हुआ है तुमने ये। हाँ जी क्यूट, ओके एग्जैक्टली, हॉर्स शू शेप किडनी, टर्नर सिंड्रोम, ओके वैसे आप कह रहे हो क्या? हाँ जी ठीक है, चलो नेक्स्ट क्वेश्चन। अच्छा अब तो बता दो प्लीज, कैन वी प्लीज हैव वन आंसर, do we have any cardiac condition causing hypertension? Any one which is important? We have done this million times, Osama, we have done this million times, what do you think bro? And do we have any cardiac, दिमाग लगाओ, good, wait, प्लीज स्क्रैच योर नी जॉइंट, घुटने पे खारिश करें, कई बच्चों में घुटने में दिमाग होता है, घुटने पे खारिश करने से दिमाग बढ़ता है, खारिश की, हाँ याद आ गया, हैव यू हर्ड ऑफ कोआक्टेशन ऑफ एओर्टा? ओह अच्छा अच्छा, वेरी गुड ओसामा, सी हो है ना, कोआक्टेशन ऑफ एओर्टा, डू यू रिमेंबर कोआक्टेशन? दिस इज माय एओर्टा, दिस इज द, देयर इज अ obstruction, so basically blood in the upper limbs basically is not able to reach the lower limbs, so more and more blood in the upper limbs causing upper limb congestion, causing change in the blood pressure in the upper and lower limbs, very importantly. So ये कहीं सुना है गलती से जीवन में, कहीं बाय मिस्टेक पढ़ा हुआ है? अच्छा वेरी क्यूट, ओके। सो द कॉजेज ऑफ हाइपर, देखो मोती की तरह क्लियर होना चाहिए ब्रो, इज इट सो टफ टू रिमेंबर? आई मीन आई वांट टू आस्क यू दिस, in small babies what are the problem for hypertension? So the take home message is kidney, okay, renal artery thrombosis, renal vein thrombosis, renal anomaly, coarctation of aorta, and bronchopulmonary dysplasias, BPD, bronchopulmonary dysplasia. Basically it causes pulmonary artery hypertension and causes raised BP. अच्छा बच्चों में क्या होगा? मान जाऊंगा मैं, कोई गलती से मुझे जीवन में बता दे, बहुत कम होता है डियर, हाइपरटेंशन इन चिल्ड्रन इज वेरी लेस, 10 to 20%, even 15 to 20 you can say. So the most commonest cause of hypertension in children, again same only, renal artery issue, okay, renal artery stenosis, Wilms tumor, ये मैं सोच रहा था कोई बता देता मेरे को, do you see hypertension in Wilms tumor? Yes, Wilms tumor is important cause. Then we have neuroblastoma and coarctation of aorta. Please, if you are a newcomer, please tell your brains, this is a very important part. Many of you who have not covered hypertension topic, it's almost we have covered hypertension. So what are the commonest causes of hypertension in small babies or infant? Very importantly, renal, this is like, tell your brains, it's the first and last time you're reading, okay? So kidney problem, activate RAS, renal artery stenosis, renal vein stenosis, renal anomaly, coarctation of aorta, and bronchopulmonary dysplasias. थोड़े बड़े बच्चों में, little big in children, same renal artery stenosis, Wilms tumor is important, neuroblastoma is important, and I can see a coarctation. And what is a late finding of coarctation? We have done this multiple times. This was the USMLE question. Chronic, if I'm suffering from coarctation of aorta today, after 6 months, or I would say after 3 to 4 months, which important finding you will see in me? We have done this. Can you please tell me? We have done. Suman, कुछ आंसर याद आ रहा है इसका, या मैं इसका भी मैं ही बताऊं? हाँ जी, कौन बताएगा? मैं नहीं बता रहा, जो करना है करो, मैं तो नहीं बता रहा. हाँ जी, एग्जैक्टली, डॉक्टर चान इज राइट. इन हाँ, इंफीरियर मार्जिन ऑफ द रिब का नॉचिंग, रिब नॉचिंग, द इंफीरियर एंगल, इंफीरियर मार्जिन. व्हाई? बिकॉज कोलैटरल्स डेवलप हो जाते हैं, तो बिकॉज द ब्लड कैन नॉट गो टू द थ्रू द मेन एओटा, सो द चैनल्स, बाइफर्केशंस, कोलैटरल्स आर फॉर्म एंड दे यूजुअली पास फ्रॉम द इंफीरियर मार्जिन, इंफीरियर एंगल्स ऑफ द रिब, कॉजिंग रिब नॉचिंग. ठीक है, डन, वेरी गुड. बड़े बच्चों में क्या कॉज होता है? व्हाट इज द कॉज फॉर द हाइपरटेंशन इन एडोलेसेंट? सो वी हैव एसेंशियल हाइपरटेंशन, very important endocrine, heavy endocrine, okay, endocrine causes are very important. So the final answer for this question are endocrine causes like hypothyroidism, hyperthyroidism, hyperadrenalism, and pheochromocytoma. These are the causes which can cause hypertension in children. At least the take home message right now is that one, that these are the beautiful important causes of hypertension in children. Okay, perfect. चलो जी, आगे बढ़ते हैं. Please look at this question. It's a very good question, Baba. Please tell me what is the answer. हाँ जी, Dr. Benedict's Baval answers. Very true. I agree with you. Yes, Sumit says, can FMG students also watch this for this time exam? Yes, my dear. Yes, you should watch it. It will be nice. We have Dr. Gundi Gowda who says, sir, आपके साथ पढ़ के मजा आ गया. थैंक यू सो मच. ठीक है, अच्छे से खत्म करते हैं. कीप इट वेरी लाइट. जिंदगी बहुत सुंदर है, हल्का होके पढ़ो. ठीक है, हल्के हल्के सब खत्म हो जाएगा. स्ट्रेस लेके पढ़ेंगे नहीं होगा. Okay, wait, let me read. Which of the following is not a correct pair? Okay, let me think. Okay. Yeah, I know this. Do you know this? Okay. हाँ जी, कौन है? हाँ जी, डॉक्टर फ्लाई ऑन द स्काई. डॉक्टर फ्लाई ऑन द स्काई. What is your real name? Could you please tell me your real name? Where are you from? Dr. Fly on the sky says D is not a correct pair of milestone. Dr. Osama, being a very important PhD holder, could you please tell me that Dr. Fly on the sky is right or wrong? 9 month pe baby will stand with support. Is this true or is this false? Yes, the answer is this is definitely true. A baby can stand with support by 9 months and standing without support by 12 months. Okay, 12 months. Remember that. ठीक है? Yeah, आपके साथ पढ़ते पढ़ते झाड़ खाने. Okay, great. So the best answer for this, Dr. Fly on the side now, he says, sorry, cute. What is your name? Tell me, I will write your name on this board. Okay, yeah. So the best answer for this question, guys, of course, like a baby can transfer objects from one hand to another. That comes by 6 months, 6 to 7 months. That's true. Truly sitting with support, or tripod position comes by 6 months. That's very well true. Hold object with both the hands. So yeah, usually 4 months baby, 4 months baby, 4 to 5 months, you can say that baby will hold object with bidex, right? Bidextrous approach and unidextrous approach. So can we remember 4 and 6? 4 महीने का बच्चा दोनों हाथ से चीजों को पकड़ता है. A 4-month-old baby hold everything with both the hands, and 6-month-old baby hold with one hand, right? So the best answer for this question कहाँ गया? Is nothing but pincer grasp. कब आता है pincer grasp? Yes, Dr. Sujit Kumar Pandey is very true. Immature pincer grasp comes by 9 months and mature pincer grasp comes by 12 months. If I'm holding something with thumb and index finger only, that is known as mature pincer grasp, which comes by 12 months. But if I'm holding something with thumb, index finger and assisted finger like this, if I'm holding something like this is known as immature pincer grasp. It comes by 9 months. Is everyone understanding this much? Please put a like button to this video, or you can give a golden heart or a black heart or a blue heart. इतना समझ में आया या चप्पल में चप्पल देख के दिखा के समझाऊं? हाँ जी, बताओ, पहले आंसर दो. yes और yes. ओके, साउंड्स गुड। कैन वी हैव अ क्विक क्विक, अच्छा जी बड़े अच्छे अच्छे क्वेश्चन आ रहे हैं सारे के सारे। चलो बताओ जल्दी से। अच्छा ये क्या है? वेट, लेट मी हाइड द क्वेश्चन ना। ओके, what is this? Is this sitting with support or is this sitting without support? Dr. Chan, golden hearts। हाँ जी, ये क्या है? This is definitely, so 5 more minutes then this class is over। Please put your best beautiful vibration and help everyone। दिस इज वेरी इंपॉर्टेंटली नोन एज सिटिंग विदाउट सपोर्ट। अगर बिल्कुल ऐसे चिपका रहता मैं, दैट इज सिटिंग विद सपोर्ट कम्स बाय 6 months। दिस इज लिटिल सिटिंग विदाउट सपोर्ट। वेरी गुड, परफेक्ट। व्हाट अबाउट दिस वन? इज दिस सिटिंग विद सपोर्ट और इज दिस सिटिंग विदाउट सपोर्ट? दिस बेबी क्यूटोपाई डूइंग लाइक दिस, इज दिस सिटिंग विद सपोर्ट और इज दिस सिटिंग विदाउट सपोर्ट? हाँ जी, कौन बताएगा? कौन बताएगा? कौन बताएगा? कौन? फ्लाई ऑन द स्काई, एग्जैक्टली, वेरी गुड। ठीक है, डर के मारे कोई गलत आंसर नहीं दे रहा। गुड, दे के दिखाओ गलत आंसर। वहीं कैमरे के में घुस के आया, मैंने घुस जाना अंदर। हाँ जी, 12 महीने नहीं मोनीमला। दिस इज सिटिंग विदाउट सपोर्ट। सिटिंग विद सपोर्ट कम्स बाय 6 months। सिटिंग विदाउट सपोर्ट कम्स बाय 8 months। स्टैंडिंग विद सपोर्ट कम्स बाय 9 months एंड स्टैंडिंग विदाउट सपोर्ट कम्स बाय 12 months। सो मोनीमला, 12 months विल बी स्टैंडिंग विदाउट सपोर्ट। ओके, रिमेंबर दैट। ठीक है, याद रहेगा। Okay, perfect. Next one, what is this? मेरा पेन लो। Yeah, very nice. What is this milestone? Could you please tell me बच्चे ने क्या किया? ये क्या किया यहाँ पे? पेन लो। पेरेंटिक्स से प्रॉफ बराबर है आपकी, आपके डरते हैं हम, डरना भी। अच्छा, वो जूली आ गई। Julie, we have a new candidate in our class. Julie, whenever there is a quiz, no, and tonight also we have a quiz at 11 p.m. and rupees 500 is the first prize. If you are guys are free, come. Tonight is the mucopolysaccharidosis hurler hunter, all scary questions we have tonight. फर्स्ट प्राइज इज रुपीज़ 500। और उसमें तो क्या होता है, उसमें बेसिकली डॉक्टर जूली एक आईडी हमारी फ्रेंड है, एंड हमेशा पता है क्या करती है वो? नहीं, बहुत पार्शियलिटी थी, नहीं ये तो फर्स्ट कैसे होगा फर्स्ट प्राइज, ये तो पार्शियलिटी हो गई, नहीं नहीं क्वेश्चन अच्छे नहीं थे, नहीं आंसर अच्छे नहीं थे, नहीं पोल ही खराब था। तो जूली हैज प्रॉब्लम विद एवरीथिंग। Hello, Dr. Julie. Good evening. So this only is nothing but very importantly you can say pincer grasp. But remember one very important thing, like this is just a OPD thing I'm showing to you, like this one. But pincer grasp के लिए I need, मतलब कैसे, how will you ask the parent के this baby is having pincer grasp? अंगूर उठा लेता है आपका बच्चा, अंगूर उठा लेता है। सो अंगूर उठाना या स्टोन को उठाना, होल्डिंग अ ग्रेप or holding a pebble, that is the best what you called pincer grasp. If I show you this, okay, if I have a, yeah, I have this toffee, okay, I have this toffee. So holding a toffee sounds like a good pincer grasp, not holding the pen. Holding the pen need lumbricals also. Today we had a DNB OSCE exam, very nice, so they were asking about lumbricals. So holding a pen requires big muscles, but just this one ऐसे ऐसे इतना रखना, ठीक है। बहुत बच्चे आए हैं आज, आजकल सारे ही आते हैं यार, आजकल तो बहुत सारे लोग आते हैं। सो हाँ जी, दैट्स व्हाट। सो विच इज नॉट अ करेक्ट पेयर, आई डोंट थिंक सो। दिस पिंसर ग्रास बाय 14 months, दिस इज नॉट अ करेक्ट थिंग, राइट? Very easy question. Can we have a very quick answer for this? Multiple options are correct, okay? ये वाला कौन सा? हाँ, ये eclairs दिया, sapphire eclairs. Do you want it? No, I will keep it here. हाँ जी, डॉक्टर सुमन, याशिका, जूली, अंगूर, ओके, सृजना। देखो हाई फाई, ये देखो अंग्रेज जब पैदा हुए थे ना, ये खाली सृजना को छोड़ गए थे। ग्रे अंगूर मीन्स ग्रेप, GRAPE। वेरी डिफिकल्ट, वाई यू डोंट नो हिंदी? Sweet, cute, my friend. Grape, you know, grape, you know, the grape also you don't know. Then it's okay, leave it. I God bless you. Okay, so grape is nothing but angur. Hanji, what is the best answer? All are correct. Oh, you sure, Yashika? ये तुम कह रही हो? Seriously, dude, all are correct. Seriously, सोच लो बेटा, मार खाने से पहले सोच लो। हाँ जी, खट्टे हैं। Okay, so vectoral anomalies, right? So V for vertebral anomalies, A for anal anomalies, C for congenital hearts, tracheoesophageal, renal and limb defects. ठीक है, the best. So do you see cardio? So very importantly, right? Do you see cardiomegaly? Cardiomegaly is not ventriculomegaly. Seriously, do you see ventriculomegaly and cardiomegaly? I don't think so. V for vertebral anomalies, anorectal, C for cardiac. Cardiac anomalies like, ventricular septal defect or some congenital hearts. Specifically saying cardiomegaly, I don't think so. That's not a part of vectoral. These are very basic question. बेटा इसमें अगर गलती की ना तुमने, भगवान, फिर तो भगवान को मंदिर होके जाना एग्जाम जाने से पहले, ठीक है? भगवान अगर सिंपल क्वेश्चन में गलती हो गई तो प्लीज कुछ मत कहना, ऐसे कर, ठीक है? रिमेंबर दैट, ओके? हाँ, ओके सर, सब गलत नहीं होगा, ठीक है? सो वेंट्रिकुलोमेगैली एंड कार्डियोमेगैली आर नॉट अ पार्ट ऑफ द वेक्ट्रल. वेक्ट्रल इज वर्टिब्रल, एनोरेक्टल, कार्डियक, tracheoesophageal, and most importantly, renal and limb. L से limb है, okay? Limb. Okay, the easiest question on this planet, anyone? डॉक्टर गिरी, मैं भी आप सा ही हूँ पर मुझे हिंदी आती है. ओके डॉक्टर गिरी, अच्छे से क्लियर कर लिया एग्जाम को, फिर दिल्ली मिलने आना, ठीक है? सेल्फी लेंगे, विल गो आउट फॉर लंच और समवेयर. हाँ जी. हाँ जी, what is this, anyone? डॉक्टर जतिन, what is this? The easiest question on this planet. इसमें बेटा गलत करके दिखाओ तुम, फिर तुम देखो, फिर तुम्हें तो मैं मोबाइल से ब्लॉक कर दूंगा, यूट्यूब पे ब्लॉक दिस पर्सन, लाइक दैट आई विल सी. विटामिन के डिपेंडेंट क्लॉटिंग फैक्टर्स, ऑफ कोर्स एवरीवन नोस, 2 7 9 10. किसी कोई महान आत्मा है जिसने ये आंसर भी गलत किया हो? मुनीमला क्या कह रही है? हाँ, सी, दैट्स व्हाट, क्या सी? मुनीमला, इधर आओ तुम, इधर. मोनीमला, कौवा खा के आई हो क्या? क्या डिनर में क्या किया? ये हैड डिनर? नो, दिख ही रहा है वो तो, यू डिडंट हैव डिनर. बेटा हाइपोग्लाइसीमिया नहीं करना, ठीक है? हाइपोग्लाइसीमिया. मोनीमला, व्हाई डिड यू आंसर सी? आंखों में मोतिया है. डू यू हैव कैटरेक्ट इन योर आईज? वेयर डू यू सी ऑयल ड्रॉप कैटरेक्ट? विल्सन डिजीज. सनफ्लावर कैट नहीं, ऑयल ड्रॉप इज गैलेक्टोसीमिया, सनफ्लावर इज विल्सन. क्या आंसर? इधर आगे आओ. गलत कैसे किया तुमने? गलत कैसे किया? आंखों में कुछ प्रॉब्लम है तुम्हारे? क्या इशू है लाइफ में, बताओ मुझे. ब्रेकअप्स, व्हाट इज द प्रॉब्लम? सो विटामिन के डिपेंडेंट क्लॉटिंग फैक्टर्स आर 2 7 9 10, ठीक है? एक्सेप्ट तो लिखा ही नहीं था ना, मैंने खुद से बनाया क्वेश्चन, मन कर गया, आज अलग सा क्वेश्चन बनाऊंगी ऐसे करके. Okay, so very important. Yes, HDN. Have you heard of hemorrhagic disease of newborn, and have you heard of hemolytic disease of newborn? Dr. Osama, could you please tell me one line answer for this, bro? One is hemorrhagic disease of newborn and one is hemolytic disease of newborn. Could you please tell me? Achha, Avinanda says yes, I think she thought about accept. Achha, you are supporting her. Next question, you also will think accept only like that. ठीक है? खुद के क्वेश्चन नहीं बनाने, घर की खेती नहीं है ये. जो पूछा है वो आंखें खोल के आंसर कर, ठीक है? थैंक यू. हेमरेजिक डिजीज ऑफ न्यूबॉर्न, वी ऑल नो दैट इज बिकॉज ऑफ विटामिन के डेफिशिएंसी. What about hemolytic disease of newborn? Dr. Fly on the sky. It's because of what, bro? Any idea? Yes, exactly. So ABO incompatibility. Like there are many causes of hemolysis, right? In a newborn, right? We have done this. Breastfeeding jaundice, breast milk jaundice, ABO, RH, enzymopathy, membranopathies, and all those things. And commonest one is Dr. Chirag is very right. Hanji, exactly. Okay. ABO incompatibility. And very good. Dr. Happiness is asking the question, which vitamin should be given in a newborn? Why? Okay. Very good question. Option number A, should you give vitamin D to a newborn or should you give vitamin K to a newborn? Please put your answer in the comment section, then I'll tell you. Dr. Happiness have a very quick doubt, which vitamin should be given in a newborn. Choose the option number A or option number B. What is the best answer? ABC. We have, that's such a nice thing someone said. ABC, the ID name is ABC, ABC. He or she is asking how to meet you in real life. How to meet you in real life. I stay in Delhi. I stay in Pitampura. I work in Hindu Raw Medical College. Come meet me. Okay? हाँ. अच्छा. ओहो 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 ओहो, लोग कैसे खुश हो गए आंसर करें. खुश. वेरी वेरी अमेजिंग आंसर्स. जो महान व्यक्ति ए और बी आंसर कर रहे हैं, द ब्यूटिफुल पर्सनैलिटीज एंड सोल्स हु आर आंसरिंग ए और बी, द बेस्ट आंसर इज बोथ. You give both. Dr. Happiness, and every newborn baby is given vitamin D at birth. What is the dose of vitamin B? दोनों देते हैं, vitamin D and vitamin K. Very quickly, can we quickly exactly Yashika, can we have quickly dose of vitamin D? Yashika, dose क्या होती है? आगे आओ तुम, डोज बताओ. मजाक चल रहा है, मजाक चल रहा है यहाँ पे. डोज बताओ तुम, विटामिन डी की क्या होती है? हाँ जी, क्या होती है? मोनीमला से सर यू डिड बेइज्जती मेरी करी मैंने करी मैंने mistakes are a proof that you are trying dear mistakes are a proof that you are trying we are family is this a joke we all love each other right so it's okay thoda bahut बेइज्जती is okay right friends right yeah the dose of vitamin D in a newborn is 400 international units in term and 800 international units in preterm very perfect answer ये 300 वाला कौन है 200 वाले भी आए अच्छा आप तुम क्या बोलूं मैं 200 नहीं आंसर 400 IU in terms and 800 IU in preterms. What about vitamin K, bro? Could you please tell me, buddies, my dear friends, my dear best buddies? अच्छा डॉक्टर फ्लाई इज डिलीटिंग द मैसेज वो कह रहे हैं इससे पहले गाली सुनने मिल जाए मैं जल्दी से डिलीट कर देता हूँ इस मैसेज को हाँ जी विटामिन के could you please tell me what is the dose of vitamin K in a term baby? I think everyone knows about it. 1 milligram, 1 mg is the dose in any baby if the baby is less than 1 kg. If the baby is less than 1 kg, then you give 0.5 milligram. If the baby is more than 1 kg or a term baby, you give 1 milligram. The dose of vitamin D in a term baby is 400 international units per day and 800 IU in a preterms. Okay. Yes, okay. So Dr. Suman, सारे के सर के नया notes money 200 300 yeah. Okay, Dr. Giri, मोनीमला सर is cool and मेरी बेइज्जती तो नहीं की तो बुरा मेरी बेइज्जती नहीं की तो बुरा लगता है मुझे प्यार ही है यार और क्या हाँ जी हो गया अच्छा करें चलो जल्दी आओ खत्म करो इट्स 9:25 द टाइम इज ओवर जस्ट वन मोर मिनट देन दिस क्लास इज डन vitamin B12 no buddy we do not give vitamin B12 to a newborn no we don't give breast milk is deficient in vitamin D vitamin K and vitamin B12 if the mother is a pure vegetarian but we don't give vitamin B12 unless you get vitamin B12 levels low then only we give so no, hemorrhagic disease of newborn number one is because of vitamin K deficiency right can we have a I am a NEET PG student okay why Ashwati is asking vitamin D is given oral syrup and vitamin K is injection vitamin D is syrup oral vitamin K is single injection over the anterolateral aspect of the thigh can you tell me the name of the muscle could you please tell me the name of the muscle where vitamin K is given do we have the name of the muscle okay okay Dr. Monimala नाराज होगी Dr. Monimala you felt bad I apologize ओके हाँ जी नहीं मजाक बनाऊंगा नहीं अब नहीं बनाऊंगा ठीक है हाँ जी रात को 11 बजे वी हैव अ क्लास 500 रुपीज इज द फर्स्ट प्राइज द टॉपिक ऑफ चॉइस इज हर्लर हंटर MPS एंड IEMs क्रेजी वंस एंड इट्स ऑन द अनअकैडमी क्लास क्या था मैं क्या बोल रहा था मैं भूल ही गया ठीक है yes perfect so हाँ जी very importantly yes the name of the muscle is nothing but very importantly we have vastus lateralis very important yes the name of the muscle is vastus lateralis this was a nursing exam question ये nurses के exams में आया था ये मेरे को भी नहीं पता था I opened the book I checked I was like oh my god ऐसा भी कुछ होता है क्या so the name of the muscle where you put the injection is vastus lateralis that's it let's how many days okay very good question how many days vitamin D is given vitamin D is given 400 IU every day till 1 year vitamin D is given 400 IU every day till 1 year of life whereas vitamin K is given single injection only single injection ठीक है exactly okay happiness has a very beautiful question sir should a MBBS graduate know how to inject the babies no dear in general I would say dear that what you called in your postings basically we also have interns posted in gynae and peds so they all know how to give injections internship में तो आना चाहिए internship में you should like in our hospital it's a busy government hospital every day 100 deliveries are there okay so the interns are always busy labor room is fully packed LSCS labor rooms all labor rooms interns are supposed to see like interns and the JR so SR teach the JR teach the interns and all interns so they only give vitamin K and vitamin D and cord clamp and cut clean the baby meconium baby bag and mask this that everything interns super amazing beautiful interns we have and वो करते हैं and if they have any doubt of course they ask the JR or SR that finishes today's class Thank you so much everyone for this beautiful participation. We have exported, he says बहुत ज़रूरी है, नहीं तो क्या इंटर्न किया, बिल्कुल मतलब ठीक है, मतलब वही मैं कहूँगा ना कि अच्छा है, इफ दे लर्न इट्स गुड फॉर देम ना, वो अपना डर को हटाओ बेसिकली. सो इट्स गुड दैट इन सच अ यंग एज यू स्टार्ट टू दिस वन put injections in a baby. It's good that way. And in our hospital, so in our previous hospital, I was in other hospital also, so even vaccination also, it all depends how you want to learn, bro. If you really want to very keen to learn, the SR and JR, you can really approach the sir, please teach me karke, and they will definitely teach you. So it's nice only. Thank you so much everyone for this beautiful participation. That finishes today's class. We have still a lot of questions, some crazy amazing questions. Will do it in the next class. Before leaving, we always have a motivating quote. Motivating quote kahan gayi? Gum gayi. Motivating quote. So very importantly, before leaving tonight, we have a class at 11:30, 11 o'clock. Sorry, not 11:30. 11 o'clock we have the class, and the topic of the choice is a test today of some strange disorders and syndromes. I mean, basically inborn errors of metabolism. First price is rupees 500. 11 p.m. tonight, Unacademy class. Come, it will be very happy to have the class. Okay, and thank you. Before leaving, we always have a motivating quote that life is short. Again, the same quote: life is short. Spend it with people who make you laugh and feel loved. That's it. Thank you so much. Please take care and see you after 1.5 hours. Bye. 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 Bye.